I am Deborah Addo. I'm the CEO here at Inova Loudoun, and what a beautiful day. I was telling people when I got up this morning, of course I looked at the weather report, just because, and I knew we were doing this outside event, and it said, oh, you're going to have this rain intermittently, but there will be moments of sunshine. So right now we are enjoying our moment of sunshine. So thank you so much. Thank you for joining us today. I want to recognize a few people who are here and make sure that we acknowledge them. So we've got a number of our county officials and elected officials. So Erin Rayner, representing the Office of U.S. Congresswoman Barbara Comstock. We have Aruj Mughal, who is representing the Office of U.S. Senator Tim McCain. From the Virginia House of Delegates, we have Delegate John Bell, Delegate Jennifer Boysko, and Delegate Randy Minshew. From the Virginia State Senate, we have Senator Dick Black, and we have, is Abby Carter here, who's representing Jennifer Wexton? I know Abby said that she was going to join us. From the Loudoun County Board of Supervisors, we have, of course, Phyllis Randall, Chair at Large. We have Ralph Bueno, who is the Vice Chair, and we have Suzanne Volpe and Kristen Umstead, who have joined us. Thank you for joining us. We, of course, have our Leesburg Mayor, who is here, Kelly Burke, and then is Gary Clemens here, who's representing the Circuit Court of Loudoun County. I know he said he was going to join us. Buddy Reiser, who is the Executive Director of Economic Development. Tony Howard, President and CEO of the Chamber of Commerce. We have Tina Johnson, who's Chair of the Board of Directors of LCCC, and then Keith Johnson, who is the Assistant Fire Chief. So, thank you all for joining us. Of course, I'd be remiss if I didn't acknowledge some of the executives from Inova, and my boss, Mr. Mark Stoddard, is here. We have Tony Burchard here, who's responsible for the foundation. Lauren Flint is here. Amit Rastogi here. So thank you for representing Inova. So when I was thinking about today, I was thinking about a number of things, and really just how do we define ourselves here at Inova Loudoun? And for me, it's pretty simple. I think we are neighbors taking care of neighbors. And some of you might know the parable of the Good Samaritan. But there's a question that's asked right at the end, and it is, who is my neighbor? And I was thinking about that because the definition of neighbor changes depending on what side of the fence that you're on. So for us, a neighbor might be a person who has means that you don't have, who's willing to give you those means to support what you need to do. So for us, those neighbors are our donors. So thank you. Another definition of neighbor might be a person who gives tirelessly of their time and their talent simply because you need them, and they don't expect anything in return. And for us, those neighbors are our volunteers and our boards. Another definition of neighbor might be the people who work tirelessly to provide a service that is much needed. And for me, those neighbors are our staff, our employees, and our physicians. So thank you for being good neighbors. And then ultimately, when you think of the story, the neighbor was the person who was in need, was the person who needed services and needed help. And there were some who had the expertise to provide it, who took the time and used their talent to give what the neighbor needed. So for those neighbors who are our patients and our families, we want you to know that we are your neighbors. We are neighbors taking care of neighbors here at Inova Loudoun. So thank you so much. So we're going to spend some time today, and I'm going to tell you about, of course, all the wonderful services that we will provide. We're going to talk about the new building, the new technology, but I would be remiss if I didn't start with our staff, because the beginning and the end are the people who actually help us do what we do. And when I was thinking about today, I met with the team and I said, well, why don't we do this? Because this is the 20th anniversary of us being on this site. So it was about this time 20 years ago that the hospital moved to this site. And so I asked the team, give me a list of all of the employees and the physicians who were here when the bricks were laid back then. And I thought it would be a small number. Much to my surprise, as I heard from both our staff and from our physicians, there are so many people who were here from the beginning, who helped to lay the foundation for what we do and how we do it, who've established the reputation in this area for excellence. And those are the people that I want to recognize right now. So if you are an employee who's been here, who's helped us, a physician who's been here from the beginning, if you could just raise your hand so that everybody gets a chance to see that we've got make it happen, and trust me, they keep me hopping. So I'm glad that they're out here today. So a couple of things. When I think about community leaders, and I was actually talking to one of the physicians before I came up here, and he was reminding me that there was a time that the hospital was probably not as prosperous as it is, not on good footing. And he reminded me, and I knew this, of some of the people who helped to bring that together, to help to establish the relationship here. And I want to recognize some of those folks. So Mr. Mark Stavish, Mr. Mark Lowers, and of course Pat Walters, who helped to negotiate that whole process of bringing together the hospital and Inova and ensuring some of the good work for the future. And I know that some are here, so I just wanted to, I know Pat wasn't able to join us, but I just wanted to make sure that we acknowledge the people who had the vision way back then as we look at where we are today. So thank you for all of that. And then we also have a number of people who volunteer, so I want to make sure that I don't forget them. We have a number of boards. We have our hospital board, we have our health system board, we have our foundation board, we have our campaign board, we have the ladies board. So if you represent a board here, if you could just quickly stand, because we really do appreciate all of the good work that you do. So if all of the board leaders and members could stand. And our board works hard, they play hard, and they give hard. And so I just wanted to say, and even as we've kicked off the campaign, we still have people who are stepping up and saying, I want to be a part and I want to assist you. Most recently, Scott Hamburger from his group, Integris Holdings, and our Vice Board Chair, Christine Brennan, have both stepped up to say, we want to support you and be a part of where you're going. So I just wanted to thank them. We are also fortunate because we've got a lot of people who laid the foundation for us. And I want to make sure that I recognize the Schauffele family for what they've done. Their $5 million gift. And when we think about where we are now with heart care, where we're going with that, we would not be where we are if it were not for the Schauffele. So I just wanted to say thank you for everything that you've done. As we continue, I think about the emergency department, the trauma center, and we have some people who had the vision for that. And so I want to make sure that we recognize Sharon Vertz and Scott Miller for being leaders as we look at where we're going with that. And you're going to hear from Sharon a little bit later today. Our ladies board, they work tirelessly, and I think very soon we have the rummage sale coming up, and so they have been working hard to make this happen. It is an award-winning rummage sale, so just so that you know. And all that they raise and all that they do, of course, pours right back into this organization. So thank you for all of the work that you're doing and the leadership there. And of course, our physician partners, Commonwealth Emergency Physicians, so they provide great care and they also support us. So we wanted to say thank you to them. The people who are helping us do this work, so HDR, which is our architect, our lead architect, they also have contributed. So there are a number of people who are not just helping us build it, but they're also helping us lay the foundation for the future. So many. So why are we here though? In the spring of 2020, and I've stayed on my team, this will be on time and on budget. For those who aren't looking and paying attention, on time and on budget, we will be opening the new patient tower, 7-story, state-of-the-art, new technology, new services, what this community desires, what this community deserves, what this community has been asking for, and very soon we will be able to answer that. So, not only in progressive care, but ICU, and our NICU, and our pediatrics, and many of our services. And of course, it will be state-of-the-art, private rooms, so all of the things that one has come to expect when they come to have care delivered. And we will be able to do that. We also kicked off a campaign, a $20 million campaign, and that really is an aspirational campaign for us. And that's not just for what we're doing with the new tower, but it's also looking at the other services that we will need. If you think about mental health services in this community, of course it is a big need. It came out of a part of our community health needs assessment. So as we're looking at the Keller Center and the work and the services that they will provide, that's a part of what we're doing. We are opening a new breast center, and that will open next year. That is a part of the campaign. Of course, the expansion of the ED, which is now underway, is a part of the campaign. The expansion of IHVI, which is now underway, of course, is a part of the campaign. So there will be things that will be big and small, things that are visible and invisible, that are part of the good work that our team is doing. So again, I just wanted to thank everybody for that. And so for me, before I turn this over to anybody else, I want you to know a couple of things. And one is how proud I am to be representing you as the CEO here at Inova Loudoun. To my team, to my staff, to the physicians, to the board, to the community, to our donors. We are on to something big here. So I remember when I was in college, and everybody, you all remember when you would do that chant and you would say, "We are," and whoever you were. So for me, it was, "We are Georgetown." Okay, so we are Inova Loudoun. We are your neighbors. We are here, we're committed, and the best is yet to come. So before I turn this over to Dr. Puccio, I wanted to share a video that we put together that really starts to shine the light on what we're doing here. I hope you enjoy it, and then Ed will take the podium.
Inova Loudoun Hospital has cared for this community for more than a century. And we plan to care for generations to come. We're growing, rising, taking health to new heights. We're ensuring that Loudouners will always have access to high-quality medical care, advanced technology, and cutting-edge healthcare facilities. Close to home. It's our promise. And here's how. We've made additions. we've made expansions. We are renovating and expanding the ER at Inova Loudoun Hospital to be bigger, better, and faster. And we were designated Loudoun County's first and only trauma center. And we're just getting started. Here's what's to come. We're continuing to expand the Inova Heart and Vascular Institute Schauffeld Family Heart Center. We're expanding our cancer center and services to include a new breast center. We're expanding our intensive care unit. And we're building a new patient tower. We're growing, rising, taking health to new heights, and keeping you close to home. Learn more at inova.org/LoudounFuture. Inova, join the future of health.
That was great. Thank you, Deborah, for your introduction prior to the video. And thank you, everyone, for being here on this beautiful and very exciting day for Inova Loudoun Hospital and Loudoun County. I am one of the physicians Deborah mentioned in her remarks who has been here for more than 20 years. I do miss the days when patients used to say to me, "Are you old enough to be a doctor?" Or, "Have you ever done this before?" Those days are gone. I started working at Loudon in the original ER on our Cornwall campus, and I actually worked the last shift there before we moved to this campus. And now I still continue to work there as the hospital did recognize the importance of having emergency services that are accessible to our Western Loudoners, and I'm very grateful that the hospital was willing to do that. And I also can't thank Mike and Teresa Wheeler enough for transforming that facility. I mean, many of you have seen the old ER that we had worked in, now the new ER, and really due to the Wheeler Family Emergency Department, it is truly an emergency department that is state-of-the-art and one that we are very proud of, so thank you very much. In these years since I got here in 1995, I have seen how Loudoun County has grown and how Inova Loudoun Hospital has worked to meet the healthcare needs of this vibrant community. I have also been fortunate enough to have a front row seat, except today, as I'm standing, and how critical philanthropy is to that transformation. So names on buildings are testaments to what our donors have contributed to expanding the programs and access to care. And the casual observer will look and admire the shiny new hospital wings or programs that the donors have made possible. But when I see these names, I see the lives of patients who have been impacted and the lives of patients who have been saved due to these individuals' vision, aspirational spirit, and generosity. My first example is the Inova Heart and Vascular Institute, the Schauffeld Family Heart Center. Fred, Karen, and Bobby Schauffeld made a lead gift of $1 million 11 years ago to make this center a reality. A decade later, it was obvious we needed to expand our heart and vascular program. Once again, Fred, Karen, and Bobby Schauffeld answered that call, and last year made a $5 million donation, the largest cash gift in this hospital's history. The Schaufeld's generosity not only enables us to expand our capacity and capability to offer more advanced procedures, ensuring the residents of this community can receive state-of-the-art care, cardiovascular care close to home, but it immediately impacted the lives of thousands of our neighbors, friends, and family members who have received care in that center. Before the Schauffeld Family Heart Center opened, Patients that would present to our emergency department having a heart attack would have to be transported by helicopter or ambulance down to Inova Fairfax Hospital to have their blocked vessel open and oxygen and blood flow restored to the dying heart muscle. Many minutes were spent in transport, losing irreplaceable heart muscle, and that impacts recovery and the quality of one's life. Minutes matter, and the Schaufelds made a difference in that. We also see the amazing impact of philanthropy in our emergency department expansion. This is a project close to my heart. My colleagues and I at Commonwealth Emergency Physicians were fortunate enough to team up again with Mike and Teresa Wheeler to establish a matching campaign for the ER fundraising effort. And we were joined by the Ladies Board, David and Amy Bosserman, the Frederickson family, Cindy and Rick Chambers, and others here today. Then we were so blessed to be introduced to Sharon Vertz and Scott Miller by one of our board members, Christina Wary. Sharon and Scott became the lead donors of this project when they seized upon our vision to become a trauma center and made a $2 million gift to make that vision a reality. They understood that rapid recognition and treatment of serious injuries saves lives. Once again, they saw that minutes matter. Sharon and Scott's dedication to our community, vision of healthcare here in Loudon, and results-oriented approach to any project has been invaluable. Thank you so much. I also want to thank the Peterson family for their generous gift for our breast care center, and that will transform breast care here at Loudon also. These donors have allowed us to move from excellent to exceptional, and we are able to do so because we help people who want to transform healthcare in this community and find their passion. These donors are not just interested in the shiny new building we are breaking ground on today. They are interested in transforming the lives of their family members, their friends, and their neighbors here in Loudoun County. I am proud to introduce my friend and my co-chair on the Loudon Rising campaign, Sharon Vertz, who is an incredibly inspiring leader in our community.
Thank you, Ed. As Ed said, I am the co-chair with Ed, and I am thrilled to be working with him on this Loudon Rising campaign. And happy to be here with all of you today on this very historic day. Many of you heard the story in the past that I have shared about my brother, who had a brain aneurysm weeding his tomato garden 2 years ago, and was triaged at the Cornwall emergency room by Dr. Puccio, we found out later. And then was rushed by helicopter to the Inova Fairfax Hospital, where he spent over a month recovering. We didn't think he was going to make it, and he did. He'll often say that I'll say he's 95% there, and he'll say, 100% sis. Well, I can't remember anything, but that's okay. Anyway, he received great care while at Inova Fairfax, but I feel strongly that we need to do more here to provide these tertiary services close to home, which is why Scott, my husband, and I made our gift last year to build this advanced trauma center here in our county, in Loudoun County, close to home, because the families are so very important to anyone's recovery from any kind of injury or any kind of health issue. When I heard from Dr. Puccio that the leading cause of death for individuals under the age of 44 is trauma. So if you're under 44, this trauma center is really important for you because it's the leading cause of death amongst people in those age groups. I knew that we had to be part of bringing trauma here to Loudoun County. Trauma care, sorry, not trauma. Trauma care here to Loudoun County. Soon after we made our gift, and shortly after the hospital started, Scott and I were, the trauma care started, Scott and I were in a meeting over here with the folks in the emergency department. And they shared with us a story of an accident victim who had a femoral artery bleed, who would have otherwise gone to Inova Fairfax, but could be treated and was treated here. What was a life-threatening injury sent her home from the hospital in just a few days. That's when we knew we had done the right thing in making our gift. Loudon Hospital is a non-profit hospital. Non-profit. I don't know if you all knew that. I didn't know that. I grew up here. I was born here in this hospital. Non-profit hospital. It is a pillar of our community. And we need our community to step up and help us make it the best it can be. So please join us in this Loudon Rising campaign. Please join me now in welcoming President and COO Mark Stoddard of the Inova System. Mark.
Good morning. I'll tell you, what a wonderful day at Inova Loudoun in Loudoun County. It's a beautiful time to announce the new patient tower and the new master facility plan getting underway, as well as a beautiful day. So I hope that before I start, I want to acknowledge Mark Lowers again. Mark, I know you're here. I saw you. Please stand up. Mark Lowers and Mark Stavish and the board of Loudon Hospital were instrumental in their vision 12 years ago to really think about and deciding to join Inova Health System. And I think that was a great day for Inova Health System, being able to expand and to bring our services and care to Loudoun County. And I think it was a wonderful leadership from Mark and his collective board members. So I want to recognize them, and they've stayed in touch, have done a great job supporting this community and representing this community. So just a couple of things. As Deborah pointed out, we're embarking today on a groundbreaking of an unbelievable bed tower. The profile is up here on the wall, and I don't know if you've seen it. You saw it in the video. It's pretty impressive. The bed tower is an incredible additional investment in this community as we continue to build tertiary, quaternary services, build our programs, and continue our commitment to the Inova Loudoun and the Loudoun community. Since the merger with Inova, with the Loudoun Hospital, just a couple of things I wanted to review. Inova has made about $770 million of investments in the Loudoun community. And just to kind of review a few of those, we've invested in redeveloping the Cornwall campus, the new Ashburn Healthplex, the urgent care centers in South Dulles and Purcellville, the blood service access centers, and numerous locations for primary care, specialty care, behavioral health services, and physical therapy services. I think Inova is incredibly committed to our investments and our expansion in the Loudoun community. We're here to partner with each of you to serve this community and to truly meet the needs of the community. As Sharon said, we have definite aspirations about not just new facilities and new technology. That's important, but more importantly, expanding clinical programs to make sure that we're offering high-end tertiary services, high-end physician subspecialists and subspecialists, and quaternary services as this community grows. We kind of reflect on the Loudoun community and say, Loudoun looks today a lot like Fairfax looked back in 1985, 1990. And I know growth is a double-edged sword. Many people appreciate growth, many people do not appreciate growth, but we need to be prepared. We're here to make sure we're prepared with clinical services and programmatic offering to meet the needs of this community and to keep the community local. No one wants to make that drive to Inova Fairfax Hospital unless you absolutely have to. So I think that is a primary goal of this, is to continue to invest, continue to grow, and to continue to build this health delivery system in Loudoun County. I also want to reflect a little bit on the quality of the staff and physicians at Inova Loudoun. Unbelievable. I'll tell you, we are so proud of what the doctors do every day, of what the staff does every day, because I hope you realize you are receiving care from a nationally prominent performing hospital. And really, that can't be done without the outstanding community physician leaders, without the outstanding staff that we have at Inova Loudoun. And I think they'll even do a better job with patient experience, with providing the right care at the right time in this wonderful new expanded facility. So we're very proud of everything that Inova Loudoun has accomplished. I think, as Deborah says, the best times are yet to come. We're incredibly excited. And to reiterate what Sharon said and what Dr. Puccio said, we can't do this alone. You know, we're here as a community partner. We're here as a agent to facilitate clinical growth, programmatic growth, facility growth, but we need those strong philanthropic community partners. We need to do this together. I think we have a history of doing this together with the great donors that have been mentioned today, and we want to expand on that and have deeper and stronger philanthropic partners. You know, this is a wonderful vision for 2020, but it's not going to be too many years from now. We're going to be saying, well, what does it need to look like in 2025? What does it need to look like in 2030? And that's going to require additional partnerships, additional investments, and continued expansion of all of the clinical services that we perform here. So with that, congratulations on this wonderful day, and we look forward to great things to come. Thank you.
Thank you to Mark, to Dr. Puccio, to Sharon. Thank you all. Thank you to everyone who came out. And you know, I think it was Stephen Covey who said, begin with the end in mind. And so when I think about the end in mind, and Mark mentioned, this year we were ranked by US News and World Report. So in the DC area, we were ranked as number 7. Out of over 50 hospitals. In the Virginia area, we were ranked as number 14 out of over 120 hospitals. So if we're beginning with the end in mind, when you come back, spring of 2020, I hope to stand before you and say, we are number 1. We're beginning with the end in mind. Thank you so much for coming out and joining us.